Fracture neck of femur. Hi, I'm Lali. I'm an occupational therapist, and I'm here to help you understand what a neck of femur fracture is and which body systems are involved. The femur, or thigh bone, is the longest, heaviest, and strongest bone in the human body. Its main roles are to bear weight and provide stability while walking. It's located in the lower limb and supports your entire body weight when standing upright. Some basic structures of the top of the femur are head, neck. This is the weakest part of the femur. Greater trochanter, lesser trochanter, intertrochanteric area, subtrochanteric area. A femoral neck fracture, also called a hip fracture, is a serious and common injury in orthopedic care. It involves the skeletal system and happens inside the joint capsule of the hip. This ball and socket joint connects the femur and the pelvis. Since this type of fracture happens inside the capsule, it's known as an intracapsular fracture, and early diagnosis and management are crucial to avoid complications. Fracture types: incomplete fracture, the bone stays in alignment. Complete fracture, the bone is out of alignment. Vascular system. The vascular system is also involved in this type of fracture. The medial and lateral circumflex femoral arteries pass near the joint capsule, bringing blood to your femoral head. Blood carries oxygen and nutrients that your bones need to heal and stay healthy. When this flow gets blocked, the bone can't stay healthy and may begin to die. This is called a vascular necrosis. Incomplete fractures may still have an intact blood flow to the femoral head, meaning the head of your femur can potentially be preserved. In contrast, complete fractures block the blood flow, and the femoral neck often needs to be removed and replaced. After surgery, your body may be prone to forming blood clots due to factors like reduced mobility, existing health conditions, and your body's natural response to injury. Muscular system. Some of the ligaments that surround your hip joint capsule are the pubfemoral, ischiofemoral, and iliofemoral ligaments. This helps support the joint and limit movements that could cause overstretching, dislocation, or instability. After surgery, loss of muscle mass can lead to disability and loss of independence. Some of the muscles that play a key role in hip and leg movement are primary muscles responsible for bending and extending your leg, muscles in charge of moving your hip backward, muscles responsible for tilting your hip bone upward, muscles that allow movement of your leg to the side, primary muscles responsible for moving your leg toward the middle and across it, muscles in charge of the movement of your hip outward, primary muscles responsible for moving your leg toward the middle part of the body and across. Nervous system. Early treatment of hip fractures can help reduce postoperative delirium, a condition that may cause confusion and disorientation after surgery. Surgical intervention is usually recommended for most patients. Options include in situ fixation, closed or open reduction with internal fixation, and hemiarthroplasty. The choice of procedure depends on the stability and orientation of your fracture. Appropriated assessments. As I mentioned before, I'm an occupational therapist. My role is to help people engage in the occupations they need, want, and are expected to do. When you are admitted to the hospital, occupational therapists carry out a pre-operative assessment, which often includes a home questionnaire. This helps us collect information about your situation before hospital admission, helping us gain a deeper understanding of your occupational needs and personal circumstances. During the interview, we ask about how you were moving before coming to the hospital, any health challenges you experience, whether you use any mobility equipment, and if any additional equipment may be needed at home. All this helps us ensure that you'll be safely after you're discharged. After surgery, doctors often prescribe occupational therapy rehabilitation. As occupational therapists, we follow up with you, focusing on early ambulation, helping you to get moving. Transfers and mobility are a fundamental part of OT interventions. We carry out individualized assessments to analyze, investigate, and understand your needs, strengths, and limitations. Based on that, we choose the right equipment according to your mobility level and the doctor's recommendations. Some of the equipment we might use to help with your transfers and mobility includes Taurus walker, Ross return, Sarah Steady, walking Zimmer frame, walking stick. We also work closely with other healthcare professionals to deliver multidisciplinary therapy that focused on optimizing your overall function. As part of our role, we carry out functional assessments, focusing on your abilities and any environmental factors that might affect your performance in daily activities. This helps us monitor your independence and safety as you recover. Some of the everyday activities we might assess include getting out of bed, going to the bathroom, moving to a chair, morning routines, getting dressed, bathing or showering. We also work with you to set goals that are meaningful and relevant to your life. These goals are based on your input and are constantly adapted as your rehabilitation progresses. We also consider what you may need for discharge, including any equipment or referrals to other professionals.